This morning, health officials fighting to contain the deadly Hantavirus and relying on limited understanding of how it is spread, according to infectious disease experts. 11 cases, but nearly 150 cruise ship passengers and crew potentially exposed, and they are headed back to countries around the world, leaving some rattled.
This thing with the Hantavirus has me spiraling.
Do you just want us to not mass panic? Because just tell me the truth.
But this isn't the first outbreak of the Andean strain of the virus. The New England Journal of Medicine studied a 2018 outbreak, not on a cruise ship crossing oceans, but in a small Andean town in southwest Argentina. The first patient likely infected from a rodent, then at a birthday party spreading the virus to 5 more. One of them, described as very social, spread it to 6 people. Then he died. At his wake, another 10 were infected.
The spread seemed to happen pretty easily.
Yeah, absolutely. You can see that it was spread quite easily in the right setting.
In total, 34 confirmed cases and 11 deaths were recorded between November 2018 and February 2019, according to the journal. Infectious disease expert Dr. Abraar Karan says the 2018 outbreak shows similarities to how COVID spread in large gatherings.
But this is one study, this is one well-documented instance. We have not seen tons of large outbreaks of Andean virus in Argentina.
The study determined enforced isolation and self-quarantine likely curtailed further spread. But the journal study, published in 2020, concluded more research needs to be done.
What would you say is the biggest question mark right now with this virus?
I think one big question mark is to what degree people can transmit before the symptoms actually start. When you say, well, you don't have symptoms, so you're not going to transmit to anyone else, that may not be the case.
Steph, what else did the study show? Because that's, it's interesting to see one example.
Right, yeah, so it is the big takeaway, and this was just one outbreak, but instead of prolonged exposure leading to people getting infected, it does look like more casual exposure led to infections. And the study points to what they were calling a super spreader event, that birthday party, where one person came in infected, sat at a table, infected 5 people. 4 of them were at his table, but one was not. And they only passed each other over the course of the party, which is far more casual contact than the prolonged exposure that people had been talking about.
Yeah, all right.
You hate learning this stuff on the fly.
Really.
We'll be watching closely. Stephanie, thank you very much.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.